begin the ankle in the anterior ankle in the short axis. And if we look at the tendon structures, we're going to see on the foot, we'll see that the anterior tib is more medially and it inserts on the cuneiform. And then we have the extensor hallucis longus tendon that attaches to the base, attaches to the dorsal part of the big toe. Then we have the digitorums that attach to the rest of the digits. Now, one thing about this is that these tendons are superficial, so therefore they're extracapsular, and then, which means they do not go into the joint capsule. So if we're looking here on the screen, this hyperechoic part, anechoic area, is going to be the anterior tib. This regional in here is going to be the tendon with this part of the muscle belly of the extensor hallucis longus. And then off to the side over here, more laterally, is going to be the extensor digitorums. So from medial to lateral, you have the anterior tib, the extensor hallucis longus, and the digitorum, extensor digitorum longus. This region in here is the tibia, and this is the synovial fluid in here. This is actually the cartilage at the base of the tibia. So from there, what we use anisotrophy. As you can see, the anterior tib, by moving and toggling the transducer, the anterior tib comes into play. You can do a dynamic movement where you evert the foot, invert the foot, and you will see the posterior tibia move. If you move the big toe, you can see the hallucis begin to come into play, and you move more laterally to the lateral side of the foot, move the digitorums on the far lateral side come into play. From the short axis, it's easy to go. We will look at we will look at the anterior joint line, and we'll also look at the extensor tendons in long axis. Now, for reference's sake, the mid portion of the ankle, where the ankle joint lies actually over the extensor digitorum longus. So if we move slightly to the extensor digitorum longus, you will see, if I move those tendons, notice the movement of those tendons above. Here we're going to find on the left of the screen is the tibia, and as it drops down into the anterior joint space, you actually see another bony anomaly, which is the talus. From there, we'll look at this area above in this regional, just superficial to the joint is the fat pad, and just below the area in here is part of the synovium within the ankle joint. And notice by my toggling back and forth, these structures come in pretty good. Again, being at the position of the extensor digitorum tendons. From there, we can go and look at another item or area in the ankle, and that is sometimes in the dorsal part you can get what is known as a less frank injury, in which the ligaments between the cuneiform and the metatarsal are actually damaged. So by starting in a short axis view, as I'm on the base of the first metatarsal in short axis, I'm going to slightly move to the medial side, lateral side of the foot, where I'm going to pick up the second cuneiform. You can see the second cuneiform here, and this is the second cuneiform here, and the first cuneiform is here. Now, going back down, I'm going to move to the second cuneiform, and now The second cuneiform is here. And the base of the metatarsal is to the left of the screen. In between, you have the Lisfranc ligament. You have the dorsal surface as it moves up of the ligament, and it's in between these two structures. Again, this is the base of the first metatarsal. This is the cuneiform coming in, and the ligament runs. You can see the ligament runs across the tendon. Now, the purpose for this is that should this area be void of any ligamentous structure, and there's foot and the mechanism of injury shows that there may be a Lisfranc injury, this is a way of evaluating the ligament, and of course, confirmation needs to be with an MRI. That will tell you the extent of the injury. But this is a good initial screen for potential Lisfranc injuries.